Welcome back, everybody. I want to thank you for tuning into a second video based around the MS caretaker role. A lot of people looking at this may think I'm not an MS caretaker, but I do want to say that you may be a bigger part of that than you think. I myself am a caretaker to my wife, but we have such a huge support system, and a lot of people in our life are actually part of that caretaker role as well. One of the things we're going to do today is take a look at the infusions. That's one way of treating MS. There's no cure for MS, but it is one way to help put a stop to the progression of MS. And as a caretaker, I believe part of my role is to be there as a support to my wife when she goes for those infusions, just to be there if she needs anything. My wife actually has to take Benadryl because she has had a small allergic reaction to her infusion, so I'm able to actually get her there, get her home safely to make sure she doesn't have to drive, that kind of thing. And again, as far as a caretaker goes, we've actually had a few people who have been able to help step in when I'm not able to be there to take her and get her home from those infusions, and actually just to be there to support her while she's sitting through the infusion, because it is a little bit of a lengthy process, which we'll talk about a little bit more later in the video. So before we actually take a look at what it is to have the infusion and what it looks like at the infusion center that we go to, I wanted to talk a little bit about the different medications. So somebody who is newly diagnosed, being a caretaker for someone who is newly diagnosed, there are other options other than the infusion is what me and my wife chose for her treatment plan. So there's actually three different groups of medications when it comes to treating the progression of MS. Again, we're just looking to stop the progression more so than actually there's no actual cure. So it's not like the infusion or the other medications will actually fix what's going on. The first of the three, we talked about it, infusion. So I think right now there's about 4 medications currently that are infusion-based medications. There are also oral medications, which right now there are 6 oral medications on the market, and then there are the injectables, which there are 8 injectable medications right now. So a long time ago they hardly had anything to treat it. Now we're up to 18 different medications, I believe. Maybe 1 or 2 more, I'm not sure of, but as of some information I looked up recently, it was 18. Now with each medication there are risks involved, so as a caretaker one of our jobs is to also weigh pros and cons to find out like what's best for the person that we love, and ultimately it's their decision, but to be there as a support, to look at everything, to find out what may be the best route to go, and what we think are the best medications to actually talk to our doctors about. You definitely have to be an advocate. Some doctors will actually have a recommendation of what they think, and of course you definitely want to take that as like a big deal, and what you want to follow. They're the doctor, they know what's best, but you do need to be an advocate for your own health care. So like I know my wife had a ton of questions about which medication would be best for her, and of course she wanted to, when she was first diagnosed, she wanted to get right at it. And we were very lucky, she was able to take into consideration Tysabri, and we'll talk a little bit about that in a minute here. But you definitely want to look at all the different side effects and all the different things that come along with those medications. When it comes to the medication we did choose, again, we were lucky enough to have a neurologist that felt we should go right at it and attack it with what at the time was the big dog medication for MS, to attack that MS, and that is again Tysabri, which is an infusion that we have to go to Hopkins Infusion Center every 28 days. The one big thing that was scary for me as a caretaker is PML, and that happens due to something called the JC virus, which between 70 and 90% of us have the JC virus in our system, but it kind of lays dormant, and it doesn't affect most of us. The danger with the JC virus is that when you go on these infusions, they're actually immune suppressing infusions. So that's where it gets tricky. If the JC virus is present, you can still get those infusions. However, what the doctors will do, and what they always do, is they do blood work every 6 months to monitor how much of that JC virus or what level it's at. If it gets to a certain level, then the doctor will pull you off, and it can become very, very dangerous. I think the only way to actually get rid of that, I'm not 100% sure, just going off of what I remember talking to the doctor, is a plasma infusion. They basically would have to rid your body of the plasma that has that JC virus in it, and then reintroduce healthy plasma to get that out of your system. The scary part about PML and JC virus escalating into PML is PML is can actually cause death or very, very severe handicap. So it's a very scary situation. It was the biggest thing we had to weigh when it came to thinking about what we wanted to do for a treatment plan. The other scary thing about PML is when weighing other medications is it's not only been studies have found that it's not only caused by injectables. I know for sure, looking up some research, there are at least 2 oral medications. That was Tecfidera, and the other one was Gilenya, I believe. I don't know if I'm pronouncing it right, but Gilenya, which is an oral treatment as well. And then now we have Ocrevus, which is another injectable, which they're not quite sure if it could cause PML, is what I understand. But I don't think they've had any actual cases where they've seen PML as a result of the medication. But Tysabri, they have in the past seen a result of the JC virus escalating into PML. So again, that's one of the toughest decisions we had to make, was did we want to take that chance? However, with the comfort of the doctor's word that, it will be closely monitored, they know what to look out for, they believe this is the best scenario for us, or the best route to go. So I was pretty comfortable doing that because we have such a great neurologist and great team backing my wife. So, but that is definitely one of the tougher decisions we had to make, is like what medication, and if we wanted to take that chance, because it was very scary to think that something could happen to your loved one. So just being there to support their decision, being there to weigh the options is one of the bigger things as a caretaker we need to do. So I feel confident that we made the right decision. I know that, we've been on she's been on Tysabri for over I guess it would have just made 4 years this last infusion. And knock on wood, we haven't had any problems so far. We've seen a slight elevation in her number for JC virus, but technically she's still JC negative, JC virus negative. So we'll keep an eye on that and just continue to look forward to getting those Tysabri infusions. Now, we've had the opportunity to talk to her doctor, especially when Ocrevus came out. Of course, my wife was like, well, if this is something that, it could treat, it looks like it could treat both sides of the spectrum when it comes to different types of MS. But I'm a big advocate for, if it's not broke, don't fix it. So as of right now, we're going to continue Tysabri until something else may come down the pipe, or we have other options to look at, or our neurologist gives us a different way to go. With Tysabri, like I said, you have to be tested for that JC virus before you can even get the nod to go ahead for that Tysabri infusion. And with that, every 6 months, they'll test again. They'll test blood work every 6 months to see if there's any elevation in that JC virus. And like I said, thank God we haven't had to worry about that. All right, so with all that being said, I did want to give you a little bit of glimpse into our infusion center. Again, we go to Johns Hopkins. It's the Green Spring location. Their infusion center. They have some amazing people there that help us out. They're very kind, which is it's a great thing, because it is a little bit of time that you're there. You're there every month. It's people you'll see a lot. So it's a great group of people there. And we'll take a look at the infusion center, kind of what it looks like. I have some just small little clips that I'm going to add in. The infusion center, some of the equipment. It's not a lot. But just a look into what we see when we go there, and what you may have to do if you choose to go the infusion route with your loved one as well. Alright, so this is our infusion center. As you can see, there's the desktops that they use to put in all your information. I got my wife sitting in the chair. It's just a quick look at one of the 2 rooms that we have at our infusion center. Alright, so once you get there, they'll get the medication ready, but before that, they're going to do your vitals. They'll also do vitals every 20 minutes just to make sure everything's going well. Biggest thing they're looking for is change in blood pressure and change in temperature. And also, if you would happen to have a fever, they're not going to allow you to get your infusion that day. You cannot have a fever. So now that they have the medication in the process of getting ready, they have taken vitals, they now have to go and put in the IV to get that prepared for when the medication comes out. We did agree with our wonderful nurse Stephanie that if she did not get it on the first time, we would cut this out of the video. However, she does really good. So I'm going to let you watch for a few seconds and watch the actual IV go in, and they will prepare to bring out the medication and get her hooked up for her Tysabri infusion.
Okay. And did you want the conversation before we start?
It doesn't matter.
Okay.
Because she didn't say
Because
they were
it
going to
didn't
discontinue
and-
it
right.
anyway. And when I talked to her that night, she said she was seeing me at treatment, so I knew it wasn't going to be something where they said not to get it. Maybe it was something to talk about, or maybe it doesn't matter, which is fine too.
Okay.
Yeah, it shouldn't have anything. I think she's fine with me getting treatment.
Okay.
Something.
I also add in here to other caretakers and to MS patients who have not had an IV infusion and they may have it. There will be a time, especially over time, of continuing the cycle of every month or however many times you need to get your infusions, that the veins will start to become more difficult. So it may take a few times for the nurse to actually get in. Again, Stephanie does an amazing job here and gets in on the first time. But I will add a few pictures of a neat little tool that they have is a vein finder. I'll add just a few seconds of that when I put in some of the equipment that's used at the IV center. I'll also quickly mention here they actually will flush this out, and then you just want to keep an eye out to make sure that it doesn't get up underneath the skin and it actually goes into the vein. They'll just check to make sure that it doesn't bubble underneath the skin, and that's why they actually flush it out and make sure everything's going through to the vein really well. Coming up here in a second, I'll show you they actually have the IV machine here. That is what they'll hook up with the medication, and then we have the vital equipment. And then lastly here is the vein finder, which is a pretty neat looking tool here. I have a couple clips here, but you'll actually be able to see how it takes and basically almost like x-rays the skin, and you're able to see the veins underneath of the skin. It's a really awesome thing to see. Now here the infusion is complete. They are going to do vitals one last time just to make sure nothing's elevated, and the actual whole process takes about 2.5 hours for us. So it's an hour for the infusion, the actual infusion, a 30-minute flush of saline afterwards just to make sure everything gets through into the body correctly, and then 1 hour of observation to make sure that everything is okay and we don't have any immediate allergic reactions of any sort. I want to take the time to finish off the video and just thank everybody for taking the time to tune in. Again, I hope this just gets to the people that it can help the most, but I want to thank all my family and friends for all the support. Over the first video, I had over 300 views, I think, in 2 days. So I want to thank you for that. I look to get to a bigger, broader audience eventually and hope to be able to reach anybody who may need this. So please continue to like, subscribe, and I hope to have a new video out to you soon. And please share it as much as possible. Thank you, and you guys have a great day.